Welcome. In this video, we'll explore Addison's disease, its causes, pathophysiology, clinical features, and management. Addison's disease, also known as primary adrenal insufficiency, occurs when the adrenal glands fail to produce enough cortisol and aldosterone. The most common cause is autoimmune destruction of the adrenal cortex. Other causes include infections like tuberculosis, metastasis, or adrenal hemorrhage. Normally, the hypothalamus releases CRH, stimulating the pituitary to produce ACTH, which signals the adrenal cortex to secrete cortisol. In Addison's disease, adrenal failure leads to low cortisol, removing negative feedback and causing elevated ACTH levels. Patients may present with fatigue, weight loss, hyperpigmentation, hypotension, salt craving, nausea, vomiting, and hypoglycemia. Hyperpigmentation is due to increased ACTH stimulating melanocytes. Lab findings found in Addison's disease is hyponatremia, hyperkalemia, and hypoglycemia. Diagnosis involves low morning cortisol levels and high ACTH. Confirmatory tests include the ACTH stimulation test and electrolyte profile. Management includes lifelong glucocorticoid replacement, usually with hydrocortisone, and mineralocorticoid replacement with fludrocortisone. During stress, steroid doses must be increased to prevent crisis. Patients should carry a steroid card or wear a medical alert tag. An adrenal crisis is a medical emergency. It presents with severe hypotension, shock, vomiting, and electrolyte imbalances, often triggered by stress or infection. With regular hormone replacement and crisis prevention, patients can lead a pretty normal life. You can remember the Addison's disease with the mnemonic Addison. A. Anorexia. D. Dark skin. D. Dehydration. I. Increased potassium. S. Salt craving, sodium depletion. O. Orthostatic hypotension. N. Nausea. Thanks for watching. If you found this helpful, do share and subscribe for more medical content.